about to see, I think imminently, the 3 Israeli hostages released, this time in central Gaza from the Deir el-Balah refugee camp. And I'm standing here with Dr. Hagai Levine. He's the chairman of the Israeli Association of Public Health Physicians, and he heads the medical team for the Israeli Hostages Family Forum. So I thought we would ask him a few questions about what we should expect. What do you expect when we see these 3 men released in terms of their health? We're accustomed to seeing Israeli hostages paraded in public, smiling, waving. What lies behind that facade?
Well, first, like your name, Noga, they see finally the light at the end of the tunnel. And one of the hostages, or Levi, his name is actually Light. So, of course, this is a very emotional and euphoric moment. They are out. They are alive. They are back to be humans again. So, obviously, they would smile, most of them, at this moment. But this smile may hide what's in the inside. They may suffer from severe injuries to their soul and to their body that we will only learn after a long time, and the public not necessarily need to know. We first need to secure their safety, to make sure that they arrive safely through the Red Cross to the Israeli teams, and then to do a medical assessment to see if they have urgent medical problems. If they will have urgent medical problems, they will be transferred to the nearest hospital. Otherwise, they will hug and meet finally their close family members, and then will be transferred to one of the Israeli hospitals, possibly very close by here, to the Ichilov Medical Center. You can see here at the square the excitement of the Israeli public that comes here to be with the families, to make sure that life is of the essence. We are focusing in securing life, and I must say, as we know, the hostages tell us they cannot really recover until their friends from captivity are released.
Let me ask you a more specific question just for a moment. Without going into details that are inappropriate, but what medical surprises have you seen in hostages who have already been released? What has surprised you?
I don't know about surprise, because I'm saying, and I'm truly thinking, we have to be prepared for anything. We already know from our medical reports following released hostages, they may suffer from injuries in all their body systems. I can go with you, their hearing, their vision, their teeth, their heart, their brain, their kidneys, their liver, their spleen, every organ, their skin. So they may need rehabilitation from a multidisciplinary teams for all aspects. That's what is needed on the long run. But when they come, we first need this preliminary assessment to look both holistic, to look at their mental status, at their social wellness, at their medical needs, and the recovery is not simple at all. And the recovery is not only for them, it's also for the families. I follow with the families, and I can tell you, the families suffer injuries. This feeling of ambiguous loss, of uncertainty, including today. You think about the families of the 3 hostages, what about the other families of the 76? What they feel? How much more can they suffer? So this exemplifies to us that we need to be urgent. We need to push forward this deal to secure everyone and to release everyone, to get them back home. And then not only for Israel, but also for Gaza, then we could complete the recovery process for everyone. That's what we need, and we call upon to all the world leaders and to our own government to complete the deal to the end and to secure life, not death.
Thank you very much, Dr. Levine. As you can tell, Dr. Levine has become one of the most prominent voices from the medical profession in Israel to push for the completion of the 3-phase ceasefire deal. And we're going to continue reporting now during the course of the day as the process of the freedom of these hostages today proceeds.